Hi guys. So this woman sent me a message 3 days ago. She was given an episiotomy, a vaginal tear when she had her baby. The ones that your midwife give you to ease the passage of your baby. It was given to her when she had her baby, and it was taking like 6 weeks for the cut to heal. In short, after 6 weeks, the thing hadn't healed. Like it was still very wet. So I had to like start asking her how she was taking care of the site where the cut was given, and I found out that she was doing everything wrong. So I'm going to be telling you ways you can take care of an episiotomy site. When you're giving a tear, both the ones that were intentionally given or the ones that your baby's head gave you while they were trying to come out, there are ways to take care of them. Okay, you don't just go home, do whatever you want, and expect that site to heal. You know that it's in a place where air doesn't really touch it, so it's going to take more than just, you can't just leave it and then hope that it will heal. Okay, so there are specific things that you need to do that can make it heal and heal really fast. It shouldn't take as long as 6 weeks, and it's still as good as when it was just given. Okay, it should have at least healed to a very big extent. So one of the first things I'm going to be talking about is your sanitary towel. You have to make sure you change your sanitary towel at least every 4 hours. That's your pad. After delivery, the pad that you wear because of the discharge you're having after delivery, you're supposed to change them at least 4 hours, or at most every 4 hours. You're supposed to constantly change that sanitary towel. Don't wear one pad the whole day. It's wrong. 4 to 6 hours, make sure you change. And the next one is always keep that site dry. Make sure you keep that episiotomy site dry. When you use the restroom, make sure to use a clean towel to dry, like to clean yourself, to pat that place dry. Don't leave it wet or wear anything that will make that place remain wet. Okay, so the next thing I'm going to talk about is eat foods that will help your stool to be soft. This is very important because a lot of women, when they have their babies, they start going through constipation, and it's not a very funny thing to go through. It's difficult and it's painful. So one of the ways you can help yourself eat is one, eat fruits. Eat fruit not just because of the nutritious benefits. It's going to help your stool. Don't just your fruit. Eat it so that you eat it together with the fiber that comes with it. Don't use a juicer to press it out and drink only the water. Eat it together. Eat everything. Okay, you need things like banana. You need it to help soften your stool so that you don't put a strain on that area when you want to use the lube. Another thing that I'm going to talk about is make sure you have your bath at least twice a day. Your hygiene is one thing you really need to take care of if your episiotomy site is going to heal, and heal fast. Heal fast and heal well. Okay, because one of the things that will happen if it doesn't heal the way it's supposed to, or if it doesn't heal at all, is that you might have to go through that sewing again. It's not a very interesting thing to go through. Okay, so you have to make sure to have your bath at least twice every day, in the morning, at night, at least twice every day. And I talked about keeping that place clean and dry. Always make sure that you keep that place clean and dry. Another thing is when you use the restroom, do not use tissue. It's not a very good thing to use at this point, okay, because your body is open and all that. So you clean up with warm water. When you use the restroom, clean up with warm water. Make sure the water is warm. Make sure your hands are clean. Wash your hands. Then wash up with warm water, and you can use your dry towel, your very clean dry towel, to pat it dry. And the next thing is you don't sit on hot water after an episiotomy. You don't. It's called sit baths. SITZ, sit baths. You don't do sit baths with hot water. It keeps that wound fresh. It's just like having a lesion or a wound on your hand. You have a cut on your hand, and then you keep pouring hot water on it. The wound is going to remain fresh. It's not going to heal. So you just keep making it fresh. You don't use hot water for sit baths. What you do is get warm water in a bowl. Warm water, like normal warm water, room temperature water in a bowl. Add salt to it and sit on it. You can do it 3 times a day, 4 times a day. Okay, until it heals completely. As it's healing, you can be reducing the frequency that you use for it until it heals completely, until you're sure that you're okay. Now, next thing I'm going to talk about is if you see, let me let you know the signs of infection, like the signs that you see, and you know that this wound is getting infected. One is if you're perceiving any foul smell, yeah, you have to run back to your doctor, your midwife, whoever conducted your delivery. If you're perceiving any foul smell, if you're seeing anything that is pus like at the site, you're seeing something like it's like pus, or if you're having discharge that is not the normal local discharge, that thing like blood. If you're having discharges that are like yellow, gray, things like that, you have to report back to your healthcare provider. One very important thing in the care of your episiotomy site is to make sure you take your drugs as prescribed, your medication. Make sure you take your medication as prescribed. Okay, sometimes your healthcare provider will prescribe some antibiotics, they will prescribe some pain drugs or pain relief medications. Make sure you take those drugs as prescribed. Another thing is, as much as you can, rest, please. And don't go lifting heavy objects, doing things that someone who just had a baby shouldn't be doing. your body just went through like the highest kind of stress ever. So you're going to let it rest. You're going to really allow it rest. So that is one time for you to take care of your health, take care of what you eat, and rest. Okay. Then the last thing I'm going to talk about is your clothing. One, always make sure you wear very clean clothing, especially your on days. Two, wear things that are free. Make sure you wear free clothing. You're not supposed to wear anything that is too tight or things that make you very uncomfortable. Okay. I wish you the very best. And if you've stayed to this moment, please subscribe to my channel. Thank you.